Spirituality is really important for people's health and well-being, and it's what patients tell us is really important for them too when they're trying to come to terms with an illness or a new diagnosis. The Nurse and Midwifery Council for Nurses says that nurses are supposed to be providing holistic care, and that's care of the body, mind and the spirit. But of course they're quite good at the body and the mind bit, but they're not quite so sure about the spirit bit, and they have told us that they don't feel prepared for this aspect of the practice. They want more training, more guidance, more education. That's exactly what we've been trying to do with our research, is to provide that preparation, that training, that education. We've produced the EPIC Spiritual Care Education Standard, and that's the standard that's been adopted across many parts of Europe and by NHS Wales.
It's always been a requirement that students, whatever healthcare programme they're involved with, display compassionate, kind, considerate, empathetic care towards others. But perhaps what's often missed a little bit is the understanding of the spiritual needs of individuals. And what we ensured as part of the All Wales Practice Assessment document for nursing students was that the spirituality competencies, which come from the EPIC project, are incorporated within that All Wales Practice Assessment document in every year of the programme.
When I worked as a government official and as a practicing nurse myself, what you wanted to have is confidence that things that you're doing is properly evidence-based. The role for universities in that is to help uncover the evidence, explain the evidence, develop tools that can be implemented. What we have to have is a means and a mechanism to make practice change for the better based on evidence, and that's what this university has done. It's worked with the regulator, it's worked with government to say, here's the evidence, this is what we should do, and here are the tools in order to make the change. The result of that means that the way we train future nurses now is based on a set of well-proven standards that gives people the tools to have difficult conversations. And I'm afraid in the past, it was very difficult for some people to have these quite challenging conversations. And these standards enable us to both help the teachers teach the students, but also to make sure that our professionals of the future feel comfortable to have the conversations that are meaningful to our patients in Wales. It's for the betterment of us all.